All right, good evening. Good evening, everyone. Um, for this session, I would expect you to turn on your camera. Okay, we will start shortly. So our speaker is here. So before we start, I would like to read the profile of our guest speaker today. So I'm pleased to introduce Dr. Yunfei Lee, a distinguished researcher and an expert in the area of health economics and clinical epidemiology, who will be speaking at our online seminar on managerial epidemiology tonight. So Dr. Lee currently serves as a senior research officer, senior research fellow at the Department of Neurobiology, Care Sciences and Society at Karolinska Institute in Sweden, where he focuses on advancing our understanding of clinical outcomes and health services for middle-aged and older adults. Dr. Lee holds a PhD in medical science from Kyushu University and has garnered extensive experience working across multiple prestigious institutions, including the National Center for Global Health and Medicine in Japan and University of Occupational and Environmental Health as a visiting research fellow. His impressive academic background is complemented by his proficiency in handling complex data structures, data sources, such as population-based electronic claims databases and disease registries, making him highly skilled in utilizing advanced analytical tools like SQL Server, Stata, R, and Python. So throughout his career, Dr. Lee has involved in significant research projects contributing to the understanding of various health issues, including the effect of lifestyle behaviors and comorbidities on health outcomes. Recently, he has taken on roles in pivotal research initiatives aimed at promoting healthy aging and understanding the implications of healthcare practices in response to the COVID-19 pandemic. Dr. Lee has also published numerous articles in esteemed journals, illustrating his commitment to enhancing the field of public health through innovative research and evidence-based practices. His diverse experiences and insight will undoubtedly provide valuable perspectives of the intersection of managerial strategies and epidemiological practices in health systems. We are excited to have Dr. Lee to share his expertise with us today, particularly as he will present the findings of research that examine the impact of a national policy change on metabolic syndrome among the Japanese working age population. So this study published in a high impact journal and has been widely praised for its innovative use of statistical methods in evaluating policy outcomes. So Dr. Lee's work offers timely and relevant insights into how epidemiological research can inform strategic decision making and improve population health. Please join us in welcoming Dr. Yunfei Lee as he explores the critical role of managerial epidemiology in shaping effective and evidence-based healthcare policies. Dr. Lee, I hand the station to you.
Hello, everyone. Can you see my slides?
Yeah, I think everyone can see the slide now.
Yes.
Okay, we are good.
Hello everyone, I'm Yunfei, and I'm currently working at Karolinska Institute in Sweden. So the topic I will present today is the impact of nationwide lifestyle guidance intervention on health outcomes among Japanese middle-aged population with metabolic syndrome. So starting from the backgrounds, so before moving on this topic, let me make a brief introduction about the metabolic syndrome. So according to the definition from WHO, metabolic syndrome is a cluster of important modifiable conditions, and that mainly includes uh, obesity, hypertension, hypoglycemia, dyslipidemia. As we can see, the prevalence of metabolic syndrome is 22%. That is very comparable with the global prevalence of 25%. According to some clinical trials that has demonstrated the healthy eating habits and physical activities can significantly control and prevent metabolic syndrome during its early onset. So based on the very high prevalence on metabolic syndrome, Japanese government introduced the nationwide lifestyle guidance intervention program in 2008. And that's the first and only country conducted this nationwide intervention program for metabolic syndrome. So the target population is those aged 40 to 74 years with metabolic syndrome. For this program, they will provide health education on metabolic syndrome and also health counseling on metabolic syndrome through the physicians, public health nurses, and also registered dietitians. So the aim is to encourage the physical activity and healthy eating habits during the during the interview. And also 3 to 6 months follow-up support will be also provided by the public health nurses through the phone calls or emails. So in evaluating the effectiveness for this intervention program is very important in Japan. So in this study, we aimed to estimate the effect of the lifestyle guidance intervention on the change in health outcomes for the middle-aged people with metabolic syndrome in order to provide evidence on the effect of the intervention at their early age. So this study is a quasi-experimental approach. It's a causal inference study. We use the regression discontinuity design for this study. So regarding to the database utilization, so we use the Kyokai Camp dataset from the Japanese Health Insurance Association from the Fukuoka branch. In this dataset, the information on annual health checkups among people aged 35 to 74 years old, we also extracted 2-year observational data from this data set. So in details, the data in 2015 will be used as the baseline data. Data in year 2016 will be used for the change in health outcomes. So why we use this data set? Because this data set can provide the variables we needed to evaluate this policy. They include the demographic, socioeconomic, lifestyle behavior status, and also they include some weight measurements and also cardiovascular risk factors for this in this data set. So regarding the diagnosis of the metabolic syndrome in Japan, the health checkups will be held every year for employees to identify high-risk populations and also in order to provide lifestyle guidance intervention for their health improvement. And the potential people with metabolic syndrome, they will be identified according to this figure, including the obesity risk and the cardiovascular risk. And the obesity risk include the waist and circumferences and also BMI. For the cardiovascular risk factors, we include the hypertension, diabetes, and dyslipidemia according to the definition from WHO. So because we use the regression discontinuity design in this study, so I will briefly introduce about this approach. So why we so first, what problem this approach can solve? This approach to evaluate the causal inference of an intervention, and also how does it work? So as shown in this figure, we need to determine an assignment variable that can be shown as on the axis. And then we need to find a threshold for the intervention to make sure the individuals around these thresholds have similar baseline characteristics. And finally, we evaluate the treatment effect and that are due to the intervention. And how we applied this approach to our study. So we used in our study, we used 40 years as the assignment variable because the people aged 40, they will receive the intervention in Japan. And those about this age, they will consider as the treatment group. Those aged less than 40, they will be considered as the control group. They will be considered as control group because they will not receive the intervention. So also regarding to the inclusion and exclusion criteria, we have identified 350,000 people from our database. And after the excluded people without metabolic syndrome, and also without follow-up information, and also those with missing data. Finally, we identified 26,722 people for our sample size to analyze. So for the study outcome, the change of body weight measurements after 1 year intervention, they were considered as the primary outcome. In these outcomes, we include the change in body weight, the waist circumferences, the change of BMI. And for the secondary outcomes, we include the secondary outcomes for this study is the change in cardiovascular risk factors after 1 year's intervention. They include the blood pressure and also cholesterol status. And for the covariates, we include the demographic, socioeconomic, and health behavior characteristics as our covariates. And for the final statistical analysis, we fitted the local linear regression in our model. We used the age in 2015 as the assignment variable, and we evaluate the change after 1 year. We also considered the demographic, socioeconomic, and also their health behaviors as the covariates, separately by developed another 3 models separately. So regarding the results, so this table is the baseline sample characteristics. So the results was separated into 3 columns, which is the total sample size, people aged 37 to 39, and those aged 40 to 43. And those are the people those are the samples within the optimal bandwidth in the model. And so in this study, we mainly focus on the comparison between these two groups for the intervention and non-intervention groups. And this is the main result for our study. We evaluated the effect of lifestyle guidance intervention. So from the results, we have found the change of weight, body weight, the waist circumferences, the BMI, they reduced significantly after 1 year intervention program. And also significant reduction were also observed for the blood pressure. So the results were very similar after we adjusted the covariates by demographic, socioeconomic, and behavioral changes after into the model. And that's the visualized results for the change of health outcomes. The the top is the change in body. The top, the figure in the top is the change in body measurements after 1 year intervention, and the bottom is the change in cardiovascular risk factors after 1 year intervention. So finally, we also analyzed the change in health behaviors after 1 year intervention program. So especially we found that the risk for unhealthy eating habits reduced significantly. But in contrast, we didn't find any positive effect for the regular exercise or other lifestyle behaviors. So in summary, the main finding for our study, we found that the intervention had resulted in a significant reduction in obesity measurements and blood pressure levels. And also, we didn't find any significant changes in blood pressure, in blood lipids. So in detail, the reduction in waist circumferences has reached 3 centimeter, and also the weight loss reached 3 kilogram after 1 year. That is consistent with the proposal by some clinical guidelines. But for the blood pressure reduction, our result didn't reach the clinical guidelines, which is recommended as 10 millimeter Hg for blood pressure reduction. So the reason for this inconsistency is because the most of the clinical guidelines, they target population with very high blood pressure. But in our study, we have excluded those people who have taken medicines for their hypertension. They didn't receive the medications, so our population is milder metabolic syndrome. So another deeper reason for the significant reductions that may be due to the behavioral change. So from our result, we have observed improvement in healthy eating behaviors, but not for regular exercise. So there are some policy implications for our study. So first of all, this program is based on Japan, so it's widely applicable as because the employees, people will receive the national health checkups every year. We can receive the data, and also it's easy to follow them. So it's reported 1 million people per year will receive the health checkups, and this is far more than people who receive the traditional clinical interventions. And also, this program can help people with the early stage metabolic syndrome. So by promoting their self-health management through the lifestyle behavior changes. So it's different from the very intensive clinical interventions for severe metabolic syndrome. So it focused on the milder people with using a more flexible approach by dieting and exercising, not just intervention from the clinical side. So finally, this program is more affordable than the clinical treatment. So this program is only cost 60 to 180 US dollars. But the traditional clinical interventions, they will cost as 4,000 to 8,000 US dollars. This is far cheaper than the clinical interventions. So in summary, the nationwide lifestyle guidance intervention based on the annual health checkups in Japan, they can help middle-aged people with metabolic syndrome to lose weight and lower blood pressure. And also for this nationwide program, they focus on the health awareness and health promotion. This is not just the very strict weight loss or risk reduction in the clinical side. So for the policymakers, they should continue developing this program in Japan and also other countries that needs metabolic syndrome prevention and management. Also, this paper has been published in Social Science and Medicine in 2022. Yeah, this is my presentation for today. Thank you for listening. You're muting.
Oh, yeah, thank you very much for the presentation. And we are very happy and we are very thankful for that for the presentation. So if the students here have the questions, so you can ask directly to the researcher, okay, to the principal investigator. And I also could answer some questions because I was also listed as the corresponding author for this work. Yeah, so yeah, if you have questions, you can ask now. Okay. All right. It seems that we don't have any question from my students, so we will end the session by doing this photo taking. Okay, we're going to take photos. Okay, everyone, please turn on your camera. Okay, so Dr. Zul, can you take the photo? All right. So yeah, just smile. All right. So bye-bye, everyone. So good night for the class. For my students, for C, you're going to see me tomorrow. So please get yourself prepared for the presentation. That's all from me. Bye-bye.
Thank you, Doctor. Bye-bye.
Thank you, Doctor.
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 So tengok tu, ada student lagi yang pergi somewhere. Kau mute. You mute.
Iman, awak tengah buat apa?
Oh, sorry doktor, saya baru balik dari toilet. Thank you so much doktor.
Okay. Session sekejap pun nak pergi toilet ni korang ni lah. Tak sah tak pergi toilet. Okay, thank you so much to Dr. Aziz. I will share apa picture tadi yang nanti student aku suruh student group D yang ambil, nanti aku share dengan kau lah.
Tapi ada recording juga ni.